We would like to acknowledge the traditional owners of country throughout Australia and recognise their continuing connection to land, water and culture. We pay respect to elders both past and present. We acknowledge today's Tasmanian Aboriginal people who are the ongoing custodians of this land, Tasmania, Lutruwita. Welcome to the Emergency Department. We know you may be feeling unwell and want to be treated as soon as possible. We are doing our best to get to you as soon as we can. While you are waiting, here is some important information you need to know. If you have just arrived and need to see a doctor, please wait in line to see the triage nurse. Once you have been seen by the triage nurse, they will direct you to the appropriate waiting area. Before sitting down, all patients need to speak to the clerical staff to ensure that their details are correct. If at any time you start to feel worse or have questions, please speak to the triage nurse. Space here is limited, so only one support person at a time may stay with you. You might be asking, what's taking so long? The emergency department is open 24 hours a day, 7 days a week. We see about 100 patients a day. Some are very sick, injured, or have a life-threatening condition and need to be seen immediately. Nurses, doctors and other staff are working hard to see and treat all of our patients. Even when the waiting room looks empty, there's a lot happening behind the waiting room doors. The emergency department is not like a normal doctor's surgery. There is no queue here. Some people need to be assessed urgently. We see those people first, no matter when or how they arrive. So other people might be seen before you, even if they come in after you. If you saw the triage nurse on arrival, you are in our system and we know you are here, even if you move to a different area. So we can help you faster, sometimes we start tests while you are waiting, such as X-rays and blood tests. We will see you as soon as we can. If you start feeling better or want to see your GP instead, you can leave at any time. Please talk to the triage nurse before leaving. So, what happens next? When you come into our treatment area, you will meet different staff. We will introduce ourselves. Please ask if you can't remember what job we do. Your visit to the ED will take longer than a visit to the GP. It takes time for tests to be done and for results to come back. We often wait to see if your treatment is working. We may need to discuss your care with other staff. We will involve you when deciding the best treatment for you. You might be admitted to hospital if you need ongoing care. Most people are treated and are then well enough to go home. If you do go home, make sure you understand the treatment you were given and what happens next. Please ask us questions if you do not understand what is happening at any time. Thank you for your patience. We will be with you as soon as we can.